This week's Ask Dr. Durie is from a lady who wants to know about the use of supplements. She's read about many supplements that could be helpful for myeloma and wants to know what, if anything, should she be taking. Well, the first part of the answer is that it is extremely important to stay in close contact with your doctor and discuss the use of any supplements. Supplements can have a lot of different side effects and can interfere with medications that you're taking for the active treatment of the myeloma. And so, number one, the use of supplements must be discussed with your doctor on an ongoing basis to make sure that you and he or she know exactly what's being used. The next point to emphasize is that despite a lot of information and a little bit of testing, there is no clear evidence at this point that any of the different supplements that are being proposed or touted really do work strongly against the myeloma. For example, turmeric is often discussed as something that could be used to treat myeloma or maybe to delay the progression of MGUS to myeloma. And although there may be little bits of evidence in the lab or elsewhere, really there is not enough strong evidence to say that a patient should truly be relying on that type of a supplement as a treatment for the myeloma. Now, that does not mean that supplements cannot be healthy and sometimes needed. Vitamin D deficiency, for example, is not uncommon. Maybe as many as 20% of patients with myeloma may have some vitamin D deficiency. So supplements with vitamin D3 can often be highly appropriate. But that is different than using a supplement to attempt to treat the myeloma. The one main message I would like to give for those thinking strongly about supplements is that in areas of the world where people live to a ripe old age, to be over the age of 100, which is in what are called blue zones, which can be in places like islands in the Mediterranean, in those places, people eat real food, fresh fish, fresh vegetables, fresh everything that they can get their hands on, and are not using supplements to live to a ripe old age. And so eating real food versus processed foods can make a big difference. And this is something that I've emphasized in a recent blog discussing all different aspects of what can be ideal food to take. And so what is the bottom line? Well, be very cautious about supplements. They can cause side effects. Please talk to your doctor about any supplements that you are taking. And also, please do not be relying on supplements as a substitute for the treatment of myeloma. We have so many excellent treatments for myeloma right now. In 2018, we have so many that are well tolerated, that work well, and can put you into long remission. So please don't be confused and think that supplements are really a reasonable alternative, because that is just not the way to go these days.